Get this bad boy started. All right, everyone. Welcome back to PE with Coach. This is Coach Cullen Carroll. Today, I just want to briefly walk you through the skeletal system. It's just a quick, 5-minute anatomy and phys video that I wanted you guys to look at. More so, I just wanted you to read through it. But if you need somebody to read it to you, that's what I'm here for today. All right, so what exactly are we talking about when we talk about the skeletal system? Well, we're talking about the bones and the joints of the body. What these are going to do is they're going to allow for movement, right? So if our muscles have nothing to pull on, then we can't necessarily move our bodies around. So the bones provide those surfaces and then the joints for our muscles to produce those movements around. We have about 206 bones in the body. Depends on who you are. Some people have a little more, some people have a little less. There are some different pathologies that can result in that being that number being greater or smaller. And then if we wanted to give a few words for what the basic purpose of the skeletal system is, it's going to be leverage, right? Within those joints, it's going to give the muscles something to pull on. That's kind of what we mean by leverage. And those change, they're larger and smaller depending on the size of the person. It's going to be a support system, and then it's also going to be something for protecting some of the main organs in the body. So our skeleton has two major components to it. There's the axial skeleton and the appendicular skeleton. The axial skeleton is going to consist of the skull, the vertebral column, which is the spine. It houses the spine. The ribs, which is kind of that protective mechanism for our heart and lungs and some of our internal organs below those. And then our sternum, which is going to be right in the middle of the ribs there. Then we have the appendicular skeleton, which is made of the shoulder girdle. So think of like the collarbones and the scapula, those types of areas. That's going to be the shoulder girdle. The bones of the arms, things like the humerus, the wrists, all the way down to all those little tiny bones in our hands. Then we have the pelvic girdle, right, where we locate as our hips on our body. And then below that, we have the bones of the legs, things like the femur. And then all the way down to the ankles and the many bones in the feet. Similar to the hands, the feet also have lots of different bones in them. So what do we do with our bones? Well, we form these specific areas, these specific junctions on our body called joints. Right? And there's lots of different types of joints that we have in our body. Let's look at what a few of those are. We have fibrous joints, which are going to produce pretty much no movement. Think about like if you're looking at a skull, when you see those almost look like zippers or stitches, we call them sutures on the top of the skull. Those are fibrous joints, and we don't want them to move, right? They're basically just to seal in pieces of the body, have bones connect and produce no movement around them. Then we have cartilaginous joints, which are just going to have little tiny movements. Okay, if we think about the spaces in between our vertebral column or the discs, right, that house our spine, okay, those are going to be cartilaginous joints, and we want them to be able to move a little bit, but not too much, right, because we don't want to damage those important structures on the inside. We have synovial joints, which is going to be the most important joint for physical education, right? When we talk about movement, quality of movement, what we're typically talking about is moving those synovial joints, and those are going to have considerable amounts of movement, and they're going to allow us to do things like run, jump, throw, and lift things off the ground, for example. So some good examples of that would be your elbows, your knees. So like I said, those are going to be the main types of joints that we're concerned about, synovial joints, specifically when it comes to physical education, health, and wellness. And then another thing to note is when we're getting away from the bones and down closer to the joints, there are certain portions of that joint that allow it to move smoothly. Okay, those are going to be the hyaline cartilage, which is going to be kind of coated on the end of each of the long bones or the bones that come into contact with those highly movable joints. And then there's also going to be a thing called synovial fluid on the inside, which is sort of like a lubrication, kind of like oil, like you would use on parts for your car to keep things moving smoothly, or like grease on certain moving parts that you would want those portions to be able to move freely around each other without creating any friction. That's why we have synovial fluid in those joints. when we're talking about joint movement, we want to recognize that if you kind of think about it in your head, knees, elbows, hips, shoulders, you're really talking about rotations around an axis, right? So there's kind of a main moving point, and then the bones of that joint are going to move around that axis to produce movements in the body. So what we do is we also categorize our joints by the amount of directions they can move. Okay, so and as you can imagine, you look at some of these prefixes and it starts to make sense. Uni, axial, bi, meaning two, axial, multi, meaning more than two in this situation. That's kind of how you have to view that. So uniaxial would be, similar to a hinge. Think about a door opening and closing one direction, really. So we're talking about rotating around one axis, and that would be something similar to a knee and an elbow. Then you have biaxial, like we said, we're two, so movements about two perpendicular axes. So really, really simple. If you're standing in place, think about a joint being able to move forward and back, and then side to side. Think of it that way. And then when you put yourself in an anatomical position and you think about some examples of this, you would be thinking like wrists and ankles. And then the last one, you would have multi-axial joints. You're thinking about two or more, right? So we're talking about things like the hip and the shoulder. Again, think about where you're standing in place right now or where you're sitting, and think specifically about your hips and your shoulders and how you can pretty much move them in multiple directions, right? More than two. Okay, and this basically means that this particular joint in your body can just move freely for the most part. The last thing to consider here is the vertebral column, right? It's a special bony apparatus in our body, and like I said, it's special in that it houses our spine, which pretty much sends all of our electrical signals down to the rest of our body, and then brings all of our electrical sensations back up to our brain. So this is a system of vertebral bones and flexible discs, and they're going to allow our body to move freely around it. Okay, and so within this particular system, the vertebral column, you have a lot of different moving pieces, and we call them vertebrae, but we have to classify them differently because they technically have different movement capacities and different jobs. So we have the cervical vertebrae, which are located in the neck, and there's 7 of those. Right below that, you have the thoracic vertebrae. There's 12 of those, and it's kind of in the area of the middle to upper back. Below that, you have the lumbar vertebrae, and there's 5 of them there, and they're right in that lower back region. When we talk about movement deficiencies and people having a lot of pain, this is one of the areas where there is a lot of pain, and a lot of times it's these particular vertebrae that are moving excessively or not able to move enough in the proper directions that they are supposed to be moving, or even being able to be stable in certain areas that cause a lot of people pain. So we're going to spend a lot of time in the future talking about the lumbar vertebrae. So it's good for you just to kind of see the basic foundation of where that comes from when we mention that nomenclature. Then below that, we start to get into the pelvis, right? So you have the sacral vertebrae, which are fused pieces. They're part of the pelvis. Below that, you have what's called the coccygeal vertebrae, and there's 3 to 5 of those, and they extend downward from the pelvis. If you were to look at it on a body, depending on the size of it, you would kind of consider it somewhat of a tail. And this is where you can start to look at evolution as a theory and go back to see where we came from and where we're heading, and how in the past we possibly could have had a longer vertebrae, resulting in something that looked like a tail. So here's the last thing that I want to share with you from today's little fast anatomy physiology lecture. Just a nice overview of what our skeletal system looks like. If you pretty much strip all the rest of the stuff off of our body, this is kind of the basics of what we look like at a foundational level. Right? You can start to see some of those shoulder girdle things at the top, like we mentioned, clavicle, scapula. You can see the sternum in there, right? That's part of that axial skeleton. You see the humerus, that would be part of that appendicular. That's part of the arms there. The ribs, again, that's part of that axial. See the vertebral column. You could start to see the difference in a lot of those discs, like we were saying, as it moves down. The difference in the vertebrae, excuse me. Get down to the pelvis down here, right? And we move a little bit further. You can see some more bones in the hand, the radius, the ulna. We've talked about a couple of those bones with respect to taking a pulse, if you guys remember that. A nice vague way of putting the hand bones, is to call them carpals and metacarpals, right? There's plenty of different bones in the hand. You don't need to memorize them. You just need to recognize that they're there. We see the femurs. We see this special little bone that a lot of us usually call a kneecap. Well, just so you know, there is a scientific name for it, the patella. Down into the lower part of the leg, you see the tibia and the fibula. And then we have the metatarsals. And that'll pretty much do it for today. So this was the intro to body systems. This was the intro to our fast anatomy and physiology lectures here at Physical Education with Coach. And I will see you next time.